Hey everybody, we're back for respiratory number 2. We're doing anatomy now. We're going to start with the nose, walk our way all the way down into the lungs. The nose, of course, has the external nose, which is mostly composed, or at least structurally speaking, composed of hyaline cartilage. Obviously, we got skin and other tissues in there as well. Then we got our nasal cavity back here. The opening to the nose, the nostrils. Each nostril is called a nares. Plural is nares. The little space right in here where a booger might lodge, where you have hair, is called the vestibule. And by the way, the hairs in your nose are called vibrissae. Why do you have them? For filtering, of course. And remember, inside our nasal cavity, the nasal cavity has two halves separated by the nasal septum. Let's look at the nasal septum. There are three main structures of which the nasal septum is composed. Number one right there is septal cartilage. It's hyaline cartilage, of course. Number two, part of the bony septum. That is the perpendicular plate of the ethmoid bone. And number three, of course, is the vomer. I'm sure you know those guys and know their articulations. If we look more at the anatomy of the nose, we got our frontal bone, ethmoid, sphenoid bone forming most of the roof of the nasal cavity. The floor is the hard palate. Anteriorly, the pink one here, we got the palatine processes of the maxillary bone on each side. Over there, we got the horizontal plate of the palatine bone on each side. The maxillary bone, plus the palatine bone, plus the conchae, the inferior, a bone by himself, the middle and the superior part of the ethmoid bone. This is all the lateral side of your nasal cavity. Okay. If we look inside the nose, if you use a nasal speculum here, and you shave off your nose hair, squirt out any boogers, snot, you can see the nasal conchae. In a what am I saying? In a frontal section, we can see the nice bulging conchae as well. Superior, middle, inferior. Remember, if you say concha or conchi on an exam, it'll be marked wrong. So, why do we have these conchae? Well, they enhance the surface area. That is going to give us a couple things, okay? More surface area means more mucus, more filtration, more humidification, more warmification of the air. Plus, the nasal conchae, with their swirling projections, they are going to cause airflow to be more turbulent. That is going to increase the time spent in the nasal cavity, which is going to enhance those three processes as well. All right, here is a microscopic view of a nasal concha. What I want you to notice here particularly is the quantity of blood vessels. Look at all those big dilated veins. Why would you want such a vascular conchae? Tell me at some point. All right, in the back of the nasal cavity, two holes. One, two. Here we just see one of them right here. Right there, right there. Those are the posterior nasal apertures. They're going to connect the nasal cavity, right here, with the nasopharynx, right there. By the way, the posterior nasal apertures are also called the choanae, if you want a shorter word for them. Okay, what else? Well, we got to deal with our paranasal sinuses, of which there are 5. Major function, making mucus. The mucus has got to drain into the nasal cavity to do all the mucousy things, filtering, warming, humidifying, etc. Sinuses do also lighten the skull. They create some resonance for, which is going to affect the sound of your voice. In this picture, of course, we can see the frontal sinus here, the ethmoid sinus here, and the sphenoid sinus here. If we look at another slide, we can still see ethmoid sinus here and here, but now we can see the two big maxillary sinuses. Look how dumb the arrangement is. This is a horrible engineering job here. Look at the drainage zone for the nasal for the maxillary sinuses. It goes up. That's so silly. However, it makes a lot of sense evolutionarily. This is great for quadrupeds, just not so great for you and me. Don't forget, by the way, tears also drain into the nasal cavity. Don't forget about that. That's why you need to blow your nose when you're crying. Next time you're crying for joy in anatomy class, you have to blow your nose. Remember this fact. All right, pharynx time. 3 parts of the pharynx: naso up top, oro in the middle, and laryngo right there. Let's rock through these. The nasopharynx extends from the posterior nasal aperture all along the soft palate down to the tip of the uvula. The nasopharynx is a passageway for air. It is not a food or drink passageway, thus its lining is going to be that classic respiratory system lining: pseudostratified, ciliated, columnar, epithelium, avec goblet cells. But this lining is why it hurts if you get certain foods or drinks up your nose. Drink a soda through your nose and tell me how it feels. Next time you vomit, let some vomit go through your nose. It will burn because you don't have a protective epithelium in your nasopharynx, because you don't normally let food or drink go through there. In the back, there's a lumpy tonsil here. Kind of hard to see on my model right here, but that is the pharyngeal tonsil. And on each side, laterally, we have the auditory tubes. The auditory tubes, aka the eustachian tube or the pharyngotympanic tube, connect the air in the nasopharynx to the air in your middle ear, so that you can balance the pressure between your middle ear cavity and the atmosphere around you. Of course, if you're on a plane, there is a pressure gradient. Cabin pressure around you as you're going up in the plane drops slightly. Pressure in your middle ear is greater than the pressure around you. Air tries to leave, it pushes on your eardrum. It feels uncomfortable. So you yawn, swallow, chew gum, rock your jaw, whatever you do, allowing the air a passageway out into your throat. Okay. Oropharynx, just behind the oral cavity, extending from the uvula to the tip of the epiglottis. On the lateral wall, we'll see the palatine tonsils. Now, this is a food passageway. So, this guy is going to be lined by good old stratified squamous epithelium. All right, one more pharynx to do. The laryngopharynx is the last one we got. It extends from the tip of the epiglottis down to the division between the larynx in the front and the esophagus in the back. This is also a common pathway for food and drink, thus its lining will be stratified squamous again. All right. Hey, by the way, can you find the vomer, the perpendicular plate of the ethmoid and septal cartilage on this picture? If you can't, you should try and figure that out. All right. I got nothing else for today. We'll pick up next time. Next time we'll pick up with the larynx. I felt like we couldn't do the larynx in the time remaining, so we'll do it next time. All right. If you're looking forward to the larynx, I'm sorry. We'll get to it though. Don't worry. See you later.